Hello everyone, welcome to Lok Talks. This is Dr. Lokesh Bhatia. Today I'm going to talk to you about C-Reactive Protein, CRP. Right? CRP is a protein that is produced by liver in response to inflammation in the body. It is a biomarker, which means that it can be used to measure the amount of inflammation in the body. Means if the CRP is normal, lot of times we can conclude that there is no major inflammatory process going on in the body. So what does CRP do? CRP is a part of the body's immune response. When the body detects an infection or injury, it produces CRP to help fight off the infection or heal the injury. CRP does this by the binding to white blood cells, which are the cells that help to fight infection. Why is CRP important? CRP is important because it can be used to diagnose and monitor a variety of health conditions. The main function of CRP is, which includes, number one, it is an inflammatory marker. CRP is a sensitive marker of inflammation. Elevated levels of CRP in the blood can indicate the presence of inflammation in the body. Number two, it is an infection indicator. In COVID times, one of the best indicator was to keep checking CRP. If the CRP is increasing, the infection is increasing. The CRP is reducing, it's become normal, patient can be declared normal. So, monitoring the CRP levels can help the healthcare professionals assess the severity of an infection and track the progress of treatment. Third is the tissue damage. CRP can be elevated in response to tissue damage. This makes it a very useful marker in assessing the extent of the tissue injury and or in the cases of trauma or in certain diseases. The fourth is cardiovascular risk. Elevated CRP levels have been associated with an increased risk of cardiovascular diseases. It's used as marker for assessing the risk of conditions like heart attack and stroke. Although it is not a specific diagnostic test. So CRP is a marker of inflammation, and elevated levels of CRP are often observed in the presence of inflammation or tissue damage. Inflammation is the complex biological response that the body used to defend itself against harmful stimuli, such as infections, injuries, or irritants. How is CRP measured? Right? So the CRP levels are measured through a blood test. The test is commonly referred to as the CRP test or the high sensitivity CRP, HSCRP. So here is an overview of the process. Let's discuss about it. Blood sample collection. The healthcare professional will usually draw a small amount of blood from the vein and typically from the arm, this area, and this produces, the procedure is very simple as compared to other blood tests. The laboratory, the analysis, the collected blood sample is then sent to the laboratory for analysis, and in the laboratory the serum component, the liquid component is separated from the blood cells. Right? The point comes to the CRP measurement, the levels of CRP in the serum that can be measured now, and there are different methodologies and methods to measure the high CRP levels, and it is very high sensitive, and the assays are often used for more accurate detection, and especially in the context of assessing the cardiovascular risk Even the post-surgical infections also we do monitor with these. The results are reported in milligrams of CRP per liter of blood, or in short it is mg per liter. And normally the CRP levels are generally supposed to be less than 6. Definitely the ideal levels are close to 1. So the elevated levels may include may be resulting from the inflammation in the body, infection in the body, or the underlying combination of these conditions. What does a high CRP level mean? Let's come to this direct question. A high elevated CRP typically indicates the presence of inflammation or the tissue damage in the body. CRP is a marker of acute inflammation and can be associated with various other conditions. So here are some possible reasons of high CRP levels. Infection. Number 1, CRP levels can be increased in response to infection, whether it is bacterial, viral, or fungal. Monitoring CRP levels can help the healthcare professionals and assess the severity of an infection. The second comes as inflammation. The conditions characterized by chronic inflammation like rheumatoid arthritis, ankylosing spondylitis, lupus, or the inflammatory bowel diseases like Crohn's and ulcerative colitis. These are all the problems which are monitored, and in these conditions, Crohn's disease and ulcerative colitis can also lead to consistently elevated CRP levels. The third important point is the tissue injury or a trauma. Any form of tissue injury, trauma, or surgery can cause an increase in CRP levels, and as a part of the body's natural healing response. Right. The fourth important point comes is autoimmune diseases. The autoimmune diseases where the immune system attacks the body's own tissues. Okay. This is called autoimmune disorder and can result in a chronic inflammation, and elevated CRP levels can indefinitely increase in such situations. Right. Then fifth important comes is cardiovascular risk. The elevated CRP levels have been associated with an increase in the risk of cardiovascular diseases, and it can be used as a marker to assess the risk of the conditions such as heart attack and stroke. And although it is not a specific diagnosis test, it just indicates that the body may have inflammation, may have infection. It has to be collaborated with other clinical conditions and CRP, ESR, and other inflammatory markers. And if you have a high CRP levels, there are a few things what you can do to lower it. Right? Try to lose your body weight. Try to bring closer to the normal, closer to the ideal body weight. Next comes is exercising regularly, eat a healthy diet, quit smoking, get enough sleep, and manage stress as much as possible by doing meditation, by doing mental relaxation exercises, by chanting meditation. Many methods one do prefer. So the CRP is an important protein that can be used to diagnose or monitor the health conditions in the body. And if you have a high elevated CRP levels, there are a few things that you can do to lower it. And if you are really concerned about your CRP levels, please talk to your doctor, and that is how one should be approaching this particular issue. That is what is very important for understanding about CRP for any person who wants to know more about this. Right. So this was the objective of making this video on CRP. A lot of people do keep asking, and particularly in this post-COVID era, in COVID times, we have been monitoring all these patients using this particular CRP as a very important inflammatory marker. As I said, it's an importance of it's a very important tool to find out the immune response the body will mount to any infection, to any inflammation, or to any tissue damage. Right, thank you very much. All the best. See you in the next video. Thank you.